Hi everyone, we are the Core Stabilization group. In this video, we are first going to discuss some general management guidelines for spinal impairments, and then we will delve into some exercise, description, and demonstration organized by position. For managing acute spinal impairments, the primary goals are decreasing pain and swelling. However, it is important to begin kinesthetic training of neutral or functional spinal posture, move in pain-free range, increase awareness and activation of deep segmental muscles, and begin basic functional training. Flexion and extension bias can be used at this point depending on the patient needs. Kinesthetic awareness involves identifying and assuming positions that reduce symptoms, as well as pelvic tilts, head nods, and chin tucks. Deep segmental muscle activation involves a drawing in maneuver to activate the transversus abdominis and multifidus muscles, and head nods and flattening the cervical lordosis to activate the longus colli and multifidus in the cervical region. Basic stabilization follows activation exercises to begin training global stabilizers. For managing subacute spinal impairments, controlled motion is key. Kinesthetic training and stabilization exercises overlap and are both very important in this stage. Stabilization exercises involve maintaining spinal control while moving the extremities with progressive resistance. After spinal control is achieved in a variety of positions and exercises, more dynamic core strengthening exercises can be introduced. Also important in this stage are stretching, manipulation, aerobic conditioning, postural education, relaxation exercises, functional activities, and body mechanics corrections. Even during aerobic conditioning, core stability should be emphasized. For managing chronic spinal impairments, emphasizing return to function, high-intensity and repetitive activities should be performed. Treatments include emphasizing core control during transitional activities, balance, mobilization, stretching, progressive dynamic functional exercises, postural education, ergonomic changes, and activity-specific training. As we have learned, directional motion may be useful in certain patient populations. Extension bias may be useful for individuals who often have a flexed posture and who experience relief with sustained or repetitive extension movements, such as herniated discs. Flexion bias may be useful for individuals who find symptom relief in flexed positions, such as in spondylosis, spinal stenosis, extension load injury, or facet pain. In cases of clinical instability, which includes hypermobility, ligamentous laxity, spondylosis, spondylolisthesis, or poor neuromuscular control of deep segmental and global stabilizing musculature, stabilization is key. Finally, we wanted to provide you with some contraindications you should know coming into this lab. During the acute phase of a spinal disc injury, it is important to avoid anything that raises intradiscal pressure, such as isometric activities like resisted pelvic tilts, the Valsalva maneuver, active trunk flexion, trunk rotation, and strong muscle contractions, such as during resisted flexion and extension exercises. During the subacute stage, activities or exercises that cause peripheralization of symptoms are contraindicated. For extension, it is contraindicated when no position or movement decreases or centralizes pain, when saddle anesthesia or bladder symptoms are present, or when pain is so severe it causes the person to become rigid and immobile when attempting movements. Extension is also contraindicated after a laminectomy. Extension with or without rotation is contraindicated if neurological symptoms or pain worsen with the motion. Flexion is contraindicated when extension relieves symptoms and when flexion causes increases in pain, neurological symptoms, or peripheralization of symptoms. Next in this video, we will be going into all of these specific exercises, so thank you very much for listening.
Alright, so we are going to do core stabilization exercises in the supine position, starting from the cervical spine down to the lumbar. First, our first exercise is going to be the deep neck flexor muscles, and specifically the longus colli. So you can use the blood pressure cuff as a biofeedback mechanism. So the first thing you're going to do is you're going to place the blood pressure cuff underneath the patient's cervical spine. And then you're going to inflate the blood pressure cuff to 20 millimeters of mercury. And you are going to give this, give the meter to the actual patient and instruct them to make a nodding motion of the head, just like doing yes or no. or just doing yes, not no. And making sure that the SCM is turned off. And she's going to nod, so flex her neck and try to get to 22 degrees of millimeters mercury and hold for 10 seconds. So she's going to do that. And if she is successful, which we are going to say she is, she can relax. And then she is going to do it again, moving to 24 millimeters per mercury. And then if that is successful, you can keep moving up in increments of 2 all the way to 30, and making sure you're holding for 10 seconds on each. And to progress that, obviously you would stop if they are unsuccessful in reaching the 10 seconds. You would stop there and you could maybe go back down and do that other one again. Or to regress, you could just simply use a towel and just making sure they're doing the motion without using the SCM, working on the deep neck flexors. Next, we're going to move into stabilization with progressive limb loading, so we can take the blood pressure cuff away. We will instruct the patient to keep a neutral spine throughout all of the entire motions. So first, it's just moving the upper extremities into positions and allowing the core to stay tight throughout it. So first, we can do gentle cervical flexion and extension, just like we just did. You can do the nodding motion, hold it for 10 seconds, and then have them relax. You could do extension in this position, so looking back and holding that for 10 seconds, relaxing. And then we can move into the upper extremities. So we can actively move our arms while maintaining a neutral spine and in all three planes. So we could do flexion, we could do abduction, so moving them out to the side. You could do one arm, you can do both arms together. Yeah. And then we could progress to doing diagonal patterns, which is also, you could also work in the PNF pattern, so moving from together, out, good, going back in. And then another suggestion throughout this, we could place our blood pressure cuff underneath our patient's spine and have it go up to about 40 millimeters per mercury and have the patient hold the meter again, and making sure that spine is staying in neutral throughout all of the motions, making sure it stays on 40. And then lastly, after you do the diagonal patterns, move into functional things. So she could go out here and reach for something, making sure keeping that spine neutral. So let's try that. We're reaching into the cabinet for something. And then we will move on to lower extremity. Alright, so you could also do the same thing with progressive limb loading of the lower extremities. So moving in all three planes, doing functional movements, working in diagonals, adding weights, so ankle weights to it, while maintaining the neutral spine. We could also move into the modified bicycle position. So having one knee flexed and one knee extended, acting like they're riding a bicycle, while maintaining and giving cues to keep that neutral spine. You could also add in the upper extremities throughout this. So you could add in the arms with it, keeping one arm and going with them, and keeping that core tight, making sure that those core muscles are nice and tight. And then to progress from this, like I said, you could add weights to them, or you could even make it an uneven surface, such as using a foam roll underneath their back, or using a towel roll to make that surface uneven, what they're laying on.
Okay, so now that we have the endurance of the core stabilizers, we're going to move into more dynamic movements. The first one I'm going to do with the cervical spine is a dynamic neck flexion movement, or a chin tuck movement. So I'm just going to have her bring her chin towards her chest and back up. If she was struggling with this, I could have her elevated on a wedge to take out some of the effects of gravity. If I wanted to progress this, I could apply some resistance to the forehead in order to
challenge the muscles a little bit more. After cervical spine, I'm going to move into more of the trunk. The first exercise we're going to do is curl-ups or crunches. So I'm going to have her keep her arms at her sides just like this, and then she is going to slowly bring her trunk up off the mat, but only enough to clear the shoulder blades. And then back down. If she was struggling with this, I could aid her in coming up to here and then having her just slowly lower down to target the eccentric movement of the abdominals. For the next one, I could also progress the curl-ups with her arms behind her head, and then she could bring the opposite elbow to this knee. Come up, perfect, enough just to clear the shoulder blades again. Then if I wanted to target more of obliques and the abdominals at the same time, I could do a double knee to chest motion. So before we do this, I'm going to have her tilt her pelvis backwards like she's bringing her belly button towards her spine, and then she's going to bring both knees towards her chest, nice and slow, and then lower back down again, making sure that we maintain that neutral spine. A couple more exercises. I'm going to have you do some straight leg raises. So I'm going to have your knees straight for this. You are going again to tilt your pelvis backwards, bring that belly button towards the spine, and you're going to slowly raise the legs up off the mat, maintaining that neutral spine again. And if you can, slowly lower back down to the mat. If she was struggling with this, I would have her stop at the point where she loses that neutral spine and increases the lumbar lordosis and lower her legs with her. For the last exercise, I'm going to have her do bridging. So I'll have both knees bent, and you're going to squeeze the glutes and the abs and lift those glutes up off the table. And slowly lower down. If I wanted to progress this, I could stand in a diagonal and do a PNF pattern where I'm applying resistance here while she's coming up. Good. And then I could also have her do bridging with just one leg, so extend one side and come on down.
Hi, this is my sister Kara, and she's going to be my patient for some of these examples that I'm going to do for you. Will you please say that it's okay that I use you?
It's okay that she uses me.
Okay, cool. So the first thing that I'm going to go through is the prone exercises that we have gone over, and the first thing I'm going to have her do is lay completely flat with her arms at her side, and we're going to do some cervical extension. So the first thing here is I'm going to have her tuck her chin to her chest and then lift her head up. As we're doing this, she's working on the splenius capitis and cervicis and suboccipital muscles, and we're making sure her head doesn't fall forward. You can relax. If her head would fall forward, she'd be using like SCM, and she wouldn't be getting the full cervical extension that we want. You can progress that by having them hold it longer, or moving them to a position, or adding more body parts with it. The next thing that we're going to do is the trunk stabilization or other core exercises where she can draw her trunk in and work on the transverse abdominis, and we can do that by using a blood pressure cuff as a biofeedback mechanism. So what you do is you take the blood pressure cuff and you put it underneath her stomach, underneath her belly button, and then you air it up to about 70 or 80 millimeters of mercury, and then you give the meter for them to look at, and then you say, all right, draw your abs into your spine and contract and pull your abs together. And as she does this, she should be able to see that the dial drops at least 6 to 8 millimeters of mercury. You can have them do deep breathing as they're doing this, or you can have them just hold it and then relax, and have them do that several times so they know how to stabilize the core that way. And that way they have a visual cue of how to stabilize the core. Okay, you can go ahead and relax. I'm going to pull this blood pressure cuff out from under her. And again, that was right underneath her belly button. And then for another one, we're going to be looking at the lower back here. I'm going to have her lay flat again. And I'm just palpating each level here at the just off the sides of the spinous process. And all you have them do is swell those muscles into your back. You can have them do that by, again, drawing that spine or drawing your belly button into your spine, and you should be able to feel the muscle bulk on either side of the spine. And those are working on the extensors of the lower back. That creates stabilization for the spine, which can be implemented in all different positions later. That's just a very simple one to do here. And then the final one that I'm going to show you is scapular retraction. So working the scapular stabilizers in the back muscles up by the thoracic area. And that's in order to provide a stable base for your shoulder to move on. So what I'm going to have her do is start with the same chin tuck that we did earlier and lift her head up. So she's got the cervical extension looking nicely. So then you can add the arms into it as well. You have them externally rotate the arms and ambidect them to about 90 degrees. So they're in a 90-90 position. And you have them extend their back up like she has already done here for us. And you can have them hold it like she's doing now. Relax. That's good. And then you can either add weights to the arms to make this a little more difficult, have them hold it a little longer, or even throw some leg action in here. So come on up again for me. Putting your arms up, hold that retraction. You can have them pick up a leg or both legs like that. And that's called a Superman. Go ahead and relax back down. And then you can also work on the lower traps here too by extending your arms out into a Y position with your thumbs up. So same thing here. Head down, chin tuck, cervical extension, and then pull those arms up to the sky with you and hold right there. And that's working on that lower trap. Okay.
How's it going, guys? So for my portion, I'm going to show you a few exercises. I guess we'll just jump right into it. So the first one is going to be a plank. So you're just going to start laying on your belly here, prop your upper body up with your elbows in your hands, and you're going to use your feet as well to help support yourself. All you're going to do is you're just going to lift your body up off of the ground. You're going to maintain this position for 30 seconds to a minute. And so what this is doing is it's working on your abdominal muscles. So gravity wants to push you down, so you're using your abs to maintain a flat back. And so it's really going to help your core stabilization muscles. To progress that exercise, you can change the angle at which you're doing it. So you can prop your arms up on an elevated surface, or your legs. You can prop your legs up on an elevated surface. So yeah, we'll just jump right into the next one. It's a plank as well, but it's going to be a side plank. So what we're going to do here is lay on your side, again, propping yourself up with our elbows and our hands here, and your feet as well. And all you're going to do is just maintain this position. Again, 30 seconds to a minute. To progress that exercise, you can extend your hand and do it up here, or you can just do a normal plank and add movements of your opposite body. So that's a way to progress that exercise. And then we're going to do some side crunches. So again, laying on our side here, your top arm is going to be down by your side. Your other hand is going to be grabbing your other arm. And what you need to do here is you need to have something to hold your legs down. Obviously, I don't have that right now. So I'm going to cheat a little bit and use my elbow, because there's no way I can do this by myself. So what you're going to do here is you're just going to crunch up to your side like this. And it's going to work on your lateral abdominals and your lateral anti-gravity muscles. And so those will be beneficial for core stabilization. To progress that exercise, you can add weight to your upper body, whether it's a vest or somehow you can do cuff weights, or as well you can interlace your fingers behind your head. That'll increase a little bit of the resistance. And another way that you can get a more full range is if you lay on a table kind of hang your upper body off so that you can go down towards the ground more. It'll just be a more range, some more movement, and thus you'll be able to strengthen your muscles, your core muscles, and throughout the full range and not just halfway.
So next we'll be working in the quadruped position, and the first exercises I'm going to have Michael do here. Are you okay with me doing this with you?
Yes, I am.
Okay. The first exercises I'll have him do here are to work on the cervical and thoracic extensors. So with these, you want to go ahead and use a padded stool or a ball underneath them for support. So you can go ahead and get on your hands and knees on top of this ball for me. So first we'll just work on contracting those cervical muscles. In this position, it's against gravity, so it's a little bit harder than compared to supine. So I want you to go ahead and pull your chin backwards, and you want to keep looking at the ground. You'll be contracting these muscles. Very good. So do a little bit of a chin tuck with it as well. Very good. So that just helps work on those stabilizers in the neck. And then from there, you'll do a limb progression. So the first one would be bringing the arms back in external rotation and doing scapular adduction. So go ahead and lift your arms back. Good. And you want to squeeze here. Good. And relax there. And it's important to just make sure that they're maintaining that good cervical position. And then from here, it'll be a 90-90 position. So go ahead and bring your arms up and squeeze the scapula together again. Very good. And then from here, it's just going into straight shoulder flexion. Good. And then bring your arms just straight down and back up. Back up straight. There you go. And back down. So then after this, it would be coming out and doing horizontal abduction. So go ahead and turn your thumbs up. Good. Come up. There you go. And squeeze here. Good. And then from there, it'll be going into diagonals. So you'll want to bring your arms out to the side and then straight down. So you'll come up here, like a Y shape. There you go. And then with these, ways to progress would be using manual resistance, bands, or weights. So you can go ahead and relax there. And then from here, let's see. From these, you can progress to standing with the back supported or going into straight standing, which is more difficult for certain exercises. And then from here, I'm going to go ahead and take his ball away so you can roll back. All right, and I'll have you get on hands and knees again. So these will work on some of the other trunk and lumbar extensors. So it's important to make sure good positioning. Go ahead and spread your knees a little bit apart. Good. And then first again here, you'll just work on that cervical extension. Very good. So I'm going to hold that there. And you want to make sure that the back is flat here and there's kind of a neutral spine going on. And then from here, you can do limb progression as well. So go ahead and lift one arm up and keep all of this steady. Very good. Back down. Bring the same arm up. Good. Back down. So with these, you want to start off just working with a repetitive motion and then going toward alternating. So you could do right arm, left arm, right arm, left arm. And then after moving one arm, you can do kicking the leg back by sliding the foot on the floor. Good. And you want to keep this steady the whole time. And keep the neck pulled up. Very good. And then from there, it would be actually lifting the leg up backwards. Good. And back down. And then after that would be lifting one arm and the opposite leg at the same time. Good. And this one works on a lot more rotational control. Very good. And if a patient was having difficulty with this, you could put a dowel rod parallel to their spine and have them try to balance it on their back so it doesn't roll off, so that'll help them give another cue so that they'll stay stable. Again, with these, you could do weights or resistance bands or manual resistance to make them more difficult. And from here, you could move to certain prone exercises to make them more challenging. Again, you could use a stool or a ball underneath their abdomen if they need more support. And then finally, we'll do a transitional stabilization exercise. So this will just be rocking back and forth. And with this, you want to make sure they keep their spine as neutral as possible, not doing a lot of extension or flexion. Good. So just rock forward and back as far as you can. You should feel these muscles in your back and then in your stomach kick in. Very good. And as we learned in PNF, you could do these resisted as well.
Okay, so now we're going to talk about how to progress someone into sitting. So first we're going to do progressive limb loading for the cervical flexors. So you're going to have them sit up straight. You can either have them supported or unsupported. Here he's unsupported, but if your patient needed support, you could have them sit with a chair that has a back on it. So first you're going to have them keep their eyes forward, their chin pulled back, and then you're going to have them lift their arms into shoulder flexion up to 90, and then abduction up to 90, making sure that they're keeping their neck straight and back down. And then you could progress that by having them go even further up into flexion and then into abduction. And that would be progressive limb loading for the cervical flexors. Then you could work on the thoracic and lumbar muscles by having them do progressive limb loading for their arms and legs here. So you could also have them do flexion, shoulder flexion. You could also have them do knee extension. You just need to make sure here that they are pulling their belly button into their spine and having them sit up very straight. So, and then you could also have them do one arm, one leg, and that would be even more challenging for them. So do one arm and one leg. Okay. Then we could do some isometrics. So for the cervical flexors, you would have them push their neck into flexion, but have them resist their pressure that they're giving them so that they stay in the same position. And then you could have them do side bending and cervical extension in the same way. All right. And then for the lumbar and the thoracic muscles, we could do isometrics by doing some PNF, some rhythmic stabilization, and alternating isometrics. So you would tell your patient to hold and not let you move them by pushing them forward. Hold, don't let me move you. Hold, don't let me move you. And then you could do some rotation. Hold, don't let me move you. Hold, don't let me move you. Good. Then we could move into some dynamic strengthening for the trunk flexors, trunk extensors, and trunk rotators. So first we're going to have them hold the resistance band. You're going to have it secure behind them at about shoulder level, and then you're going to tell them again to pull their belly button towards their spine, and then you're going to have them flex forward and come back up and go again, come back up. Same thing for the extensors, only you would go in front of them and have them go backwards and come back, continuing to remind them to pull their belly button to their spine. Then for rotation, you could have them put the resistance band under their foot and rotate towards the opposite side for rotation.
So next we'll be doing the kneeling exercises. So a lot of this could be based on the PNF exercises we've already done. So we'll do rhythmic stabilization and alternating isometrics. But the important thing here is the base of support is smaller than it would be with certain other positions like quadruped. And it requires more core stabilization and balance since he is upright. With these, you want to work from sagittal plane to frontal plane to transverse plane. So I'll first do some gentle pushes from the front and the back. So first you'll want to say, go ahead and pull your stomach in towards your spine. Keep that nice and tight. And then don't let me pull you back. You want to hold your place. Good. And then you could go from the sides. Go ahead and stay in place. And then you can go ahead and work for rotations. Don't let me rotate you. Very good. And then these rotational exercises are really good to work on the obliques, transversus abdominis, and the deep spinal extensors.
Hi, I'm going to be showing you some of the core stabilization exercises in the standing position. The standing position is definitely a progression from the other positions, and I'm going to be letting you know on ways that you can progress the standing position even further throughout. Olivia is going to be our exercise demonstrator. Olivia, are you comfortable demonstrating these exercises for me? Awesome, thank you. Okay, so Olivia first is going to work on her neck extensors. Typically you would have weights, we're using soup cans, and you would have a larger ball, but this is what we have. So you would probably have a ball about the size of a basketball. So I'm going to have Olivia extend her cervical spine and I'm going to have her extend her cervical spine so that she supports the ball between her head and the wall. And then she's going to show that she's able to do that. And then we're going to progress it further by adding soup cans in the mix, and she's going to have to alternate flexion and extension. It's just going to challenge her muscles a little bit more to keep it more of a neutral spine throughout. Are you ready? Okay, so go ahead and tuck your chin and kind of shift your neck back, and this is going to be working her neck extensors. Don't just let them do that. Okay, and Olivia has that neutral spine. Now I'm going to have her reach out and take the soup cans. Okay, and how's that feeling? Try to get that neck back into that neutral position you just had. And sometimes cueing helps. Okay, and now go ahead and go like this and keep that neutral. So with the cervical neck flexion, basically she's just we're gonna have to have the patient maintain the ball between their head and the wall and flex, push into the wall while maintaining a neutral spine. So this is kind of a next step for a cervical neck flexor. It kind of works the extensors also because you're just asking the patient basically to keep their neck in a neutral position while they're reaching out. So do functional reach outs, what the patient would do normally. We're just going to toss a ball back and forth. So Olivia, I'm going to toss a ball to you and I want you to catch it. You can move your eyes and stuff, but I want you to maintain a neutral cervical spine. So can you turn towards me? All right, and so okay, and so this is Olivia's neutral cervical spine. And so now I'm just going to toss the ball to her, and you maintain that neutral cervical spine, maintain a neutral core. So just try to keep your tummy tucked in, sort of like that drawing in maneuver that I already showed you. Okay, and then we're just going to toss this ball. Okay? And just reach out and catch it.
Oh, reach out.
Yeah. Nice. Okay. So now I'm going to work on the stabilization exercises for the lumbar, spine, flexion, and extension muscles. Basically, what we're going to be doing is we're going to be using an elastic band. You can progress this by using a heavier elastic band or placing the patient on an uneven surface like a pillow or one of those foam pads, anything that's kind of unstable. So we're doing the most basic version, and so basically we're going to use the elastic band that came in our PT kits, and I'm going to stand behind Olivia and hold the middle of it, and she's going to draw her arms forward for her flexors, and then I'll stand in front of her for the extensors, and she'll bring her arms backward. For both these exercises, you're going to ask the patient to perform the drawing in maneuver so that she's engaging her core, and throughout her core muscles are engaged, and she's maintaining a neutral spine. She also needs to focus on maintaining a neutral neck throughout so that she's working from the top to the bottom. So, Olivia, I'm going to hand you these. Go ahead and perform that drawing in maneuver before we start. Okay, you got those muscles engaged? All right, now go ahead and you can bend your elbows, and then you're going to pull the elastic band forward, okay? There you go. Okay, come back. So now we're gonna go ahead, and another way you can advance this is by asking the patient to alternate arms, because that includes a rotatory component. And if you ask them to alternate their arms while maintaining a neutral spine, it just involves more muscles that they're going to have to focus on stabilizing. So now we'll do the back extensors. So I'm just going to hold this. Olivia again is going to just bring both arms backwards, but first she's going to do her drawing in maneuver. Got it? Mm-hmm. Okay, go for it. Yep. Okay, so now I'm going to show you how to do isometric and dynamic exercises for the lumbar spine. So we're going to start out working the abdominals, and again we're using the elastic band. You can progress this by making it more resistance or by placing the patient on an unstable surface. Okay, you're going to have them up here lift. Okay, I'm going to be behind you, and what you're going to do, you're going to posterior tilt. So do it one more time. Just tuck your belly button and tuck it downwards. Make your belly button go down. Yep, just like that. All right, and do that drawing in maneuver for me. Okay, got it? Mm-hmm. All right, go ahead. And just tuck your belly button downwards. All right, so now we're gonna work the lumbar extensors. For this one, she's gonna be holding the elastic band again. And she's gonna be holding it in the same place. Before we start, I'm gonna have Olivia go ahead and do the drawing in maneuver. Go ahead and do that. Are you engaged? Mm-hmm. All right, and go ahead and extend your lumbar spine, kind of pop your butt out, and she's gonna just be increasing her lordosis and engaging her lumbar extensors. So go ahead and do it. And relax. And you're gonna come back to me, okay? So go out and come back. Now we're gonna do her rotators. So for her rotating muscles of her lumbar spine, basically we're gonna have Olivia put the elastic band on her opposite foot of where she's rotating. She's gonna extend back and rotate. You want the face camera? Yeah, we can do it both views. So let's do it. We're gonna do both. Let you guys see Olivia from both directions. So go ahead and extend back, Olivia, and rotate. Okay, and Olivia has her core engaged. She did her drawing and maneuver beforehand. Okay, and let's turn so that they can see the rotation component lift. All right.
So that's all I have for you. I hope you try these out, and see you in lab.